together today. The COVID-19 vaccine is the fastest way for our country to recover from this pandemic. We all have to do our part in encouraging Americans to take this safe and effective vaccine. I've experienced the hesitancy of some Americans to take the first shot firsthand with friends, family members, wondering whether the vaccine is safe enough for their families. The answer is absolutely yes. I got the vaccine, so did my wife, so did my children. When the FDA authorizes the vaccine for children under 12, I will encourage my children to vaccinate my grandchildren. The staff in this hearing room have gotten vaccinated. My Senate colleagues have either gotten vaccinated or had COVID themselves, which provides a natural immunity. Clinical trial data shows that Moderna and Pfizer vaccines are 100% effective in preventing hospitalization and death. And the Johnson & Johnson vaccine is 85% effective for preventing hospitalization and death from the virus. A year ago, when we were in the darkest days of the pandemic, I thought people would line up for miles to get a vaccine that kept you out of the hospital and prevented you from dying from COVID-19. I still believe that, which is why this hearing, I believe, is so important. We've experienced much loss in this country over the last year, and now we have a tool, the vaccine, to end this and to return to normal. Let's use it. The efforts of Operation Warp Speed brought our country and the world 3 vaccines to protect against COVID. They're safe and they're effective. Operation Warp Speed is a testament to American innovation and ingenuity and shows that the framework we designed in the statute actually worked. The vaccines we have for COVID are safe and they do work. Pfizer's 95% effective, Moderna's 94% effective, Johnson & Johnson 67% effective in preventing COVID-19. Today, over 177 million people have received at least 1 dose. 55% of adults in America are fully vaccinated. Over 87% of seniors, those most vulnerable to the effects of the virus, have received at least 1 dose of the shot. At least 10% of the Americans have had COVID-19. So there's also a number of people who have some natural immunity to the virus. Even with all this progress, there's so much more work to be done. I said during our last COVID-19 task force hearing with the administration that we would reach a point where we have more shots than we do arms. This moment has arrived in the United States, and we cannot be complacent. Israel showed us the roadmap for what to expect, where vaccination rates began to level off as roughly 60% of the population became vaccinated. Reports out of India and the UK of the Delta variant are evidence of the importance of protecting Americans now and encouraging everyone who still needs to get vaccinated to get it. The number of doses administered in the United States per day is falling. Earlier this month, the rate dropped below 1 million doses per day for the first time since January. That's compared to a peak of 3.3 million doses per day in April. Of the 328 million Americans, almost 284 are 12 or older, making them eligible today for a vaccine. Nearly 177 million people so far have received at least 1 dose, which means about 106 million are still eligible. Clearly, we still have a lot of ways to go to get all eligible people vaccinated and put this pandemic firmly behind us. We also cannot forget about the importance of global health security. If we do not help other countries access the vaccine, we'll not see the end of the pandemic. The way to help other countries access vaccines is to protect against COVID-19 is through the extremely successful public-private partnerships that have developed and manufactured the vaccines we have today. As I've said before, removing the intellectual property protection only ensures that we don't have the vaccines we need when the next pandemic occurs. Americans that have not yet gotten the COVID-19 vaccine need to know the benefits that come along with it. The most compelling case to me is that the shot keeps you out of the hospital. It also gets you back to work and helps keep people who you work with safe. Senator Kaine, he's not here this morning, said at the last hearing earlier this year that He wore a mask so the grocery clerks felt safe. Getting a vaccination helps keep you safe. It helps keep your family safe, and it keeps those around you safe. It also helps Americans return to the things they enjoy, like concerts, movies, baseball games, or watching the Panthers in Charlotte play. Over the next few months, important outreach efforts will continue to focus on younger people. Schools are reopening in the fall, and one of the vaccines is already available for children 12 and up. In-person learning is critical, and our efforts over the summer should be to focus on getting kids the shot, protecting them from the virus. As a grandparent, I look forward to the day when the vaccine is available to young children as well. I'm pleased to have representatives from Sesame Street here today to talk about the information families need as we prepare for that round of vaccinations. Our efforts should be focused on reaching communities that have questions. I look forward to hearing from each of our witnesses today about the partnerships and programs that you have underway to meet America where they are, answer questions, dispel myths about safe and effective vaccines, and get more shots in arms. Before I yield back, Madam Chairman, let me just say, it's hard for me to believe that the best example of innovation in this country seems to be the thing that makes individuals hesitant about being vaccinated. It happened too quickly. Well, let me assure my colleagues, let me assure the American people what I think the witnesses know. These vaccines went through the most exhaustive clinical trials of any medication that we've ever approved for this market. We haven't shortcut anything in any area of government, but we did set up a pathway for accelerated consideration that was taken advantage of. And as I think Dr. Cassidy would agree, it's the science that you follow. And when the clinical trials come back and prove safe and effective, then you should feel comfortable taking this vaccine. I thank the chair.
Thank you so much.